liver is a vital organ that plays a crucial role in our overall health. Liver diseases can be silent killers, often going undetected until it's too late. As we all know, the liver is a vital organ responsible for numerous functions. Liver disease accounts for 2 million deaths annually and is responsible for 4% of all deaths, 1 out of every 25 deaths worldwide. In Nigeria and many other parts of the world, liver disease remains a major health concern, with causes ranging from viral infections like hepatitis B and C to alcohol misuse, poor diet, and exposure to toxins. We'll be discussing about the liver and its diseases with our expert today on your favorite Health Talk TV show, The Physicians. Stay tuned. It's another day with the physicians, where your health is our business and will always remain our business. My name is Dr. Martina Agbere, the regular anchor on this program. Of course, I'm not alone. I'm here with my very, very beautiful, elegant, celebrity shrink, no other person than our very regular doctor.
I remain Dr. Emina Yusuf Kadri. And of course, welcome to the Physicians, where your health is our business.
And will always remain
our business.
I'll be discussing understanding the liver and its diseases. What comes to mind when we remember the liver? First is, so we'll talk about hepatitis.
I don't even go straight to that. I just see it as an organ that is highly abused.
Highly abused.
Yeah,
because of its function.
Yeah,
right?
Because of its function, and because a lot of us just do things anyhow, and forgetting that the liver is an eliminating organ of the body.
You think that they understand the importance and functions of the liver? Do you think people know, or they just see
people
that
are very particular about kidney shutdown, kidney because of renal failure and the dialysis. I think that is very, top on most people's mind, generally, whether you are in the health sector or not. But when it comes to the liver, it's just as if it's not just liver, but there's a huge part that we are missing. And maybe because I'm a psychiatrist, I kind of see a lot when it comes to, alcohol intoxication, drug abuse, and then I get to work with the gastroenterologist quite a number of times, because if we have to manage a patient holistically, apart from trying to, go into drug rehabilitation, this liver has been abused, it has for years, and now it's coming down with so much, and it needs to be looked into. I know the liver is kind of glossy and yeah.
Nice. But so the truth is that there was a time we were managing a patient, okay? I think I was doing house job then, and the patient had the liver cirrhosis. So we were trying to query alcohol and ask, part of the history taking is do you take alcohol? I said, no, I don't take alcohol, but I take
very quick to deny.
I don't take alcohol, I take red wine.
So like, what is alcohol and red wine?
And that will tell you, no. They say a little bit of red wine.
They will read scripture for you. No, they will read scripture for you and tell you that, a glass of wine a day keeps it. No, I'm like, but the truth is that, and some will even start telling you, my father has been taking alcohol for the past 10 years. My uncle took it for 50 years. I say, you are not your father, neither are you your uncle. You are you. But the truth now, you are coming down with X, Y, Z. And your dad for 30 years, your uncle for 50 years, nothing happened to them. So you cannot assume that because they didn't have issues, you wouldn't have issues. I think that's why we have the physicians. And we have an expert coming to talk to us.
That's going to tell us more about the liver and its diseases. I can't really wait, but he has so much that he wants to just relax. We're back after this short break. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body,
Darabite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darabite from LB Pharma. Darabite, love yourself.
Welcome to your favorite health TV talk show, The Physicians, where your health is our business. We'll be discussing understanding the liver and its diseases. And in the studio with me, we have a very cerebral guest, no other person than Dr. Chudy-Onwugaje. He's actually a gastroenterologist from REDUS Center for Digestive Health. Doctor, you are welcome to our program.
Thank you.
I love your glasses.
Thank you for having me, and thank you.
You look
You're
more like a
welcome.
professor, so you're going to tell us a lot more about. Because let's first talk about. Just want to give us a general overview about the liver before you now deep dive into the kind of diseases that can actually come from it.
Okay, so the liver is an organ that we have, and is in the abdomen, and it has a lot of vital functions. First one is important in excretion of a lot from the body. A lot of toxins that are part of the process in the human body, the liver helps to detoxify that. It also has a lot of production functions as well. It helps to produce a lot of clotting factors, proteins that we need, and so it's vital in that regard. It also has a role in digestion too. It produces what we call bile, which flows through the ducts, and it helps to digest some of the food that we eat. So it has a lot of important functions. We essentially cannot live without the liver. The liver is the one thing where you don't have a second one. You have just the one, and if it shuts down, then you need the transplant or you're dead. So it's really critical that we take care of our liver and keep it safe and healthy.
Okay.
Yeah.
So, first, congratulations from your new center.
Thank you.
It's always good we have more organizations coming up and working hand in hand with regards to mental health. I think that's a big deal. Now you've just given us something that we are taking away. Liver has no alternative. It has no duplicate.
Yes.
If there's a problem, it's either you do transplant or it just goes away. Are there people more at risk of having liver diseases? Before we go into the core liver diseases itself, who are those people more at risk, and what are the causes of liver diseases?
Thank you for that question. So that's very important. Now, with liver diseases in Nigeria, if we look at the big one, right? The big one is hepatitis B, and then hepatitis C. Now, in Nigeria right now, there are 20 million Nigerians that have hepatitis B and C. 20 million. So think about the entire population of Lagos having an infection.
That's
so
true.
It's significant. And the unfortunate thing is that almost 90% of people that have this infection are not aware of their infection.
Wow.
So you have the infection, you're walking around, you have no idea that you have it until it's caused significant damage to your liver and you present with symptoms. And so it's such a silent killer, just like you mentioned, and it's important that we are aware. So in terms of the risk factors of people that will eventually have liver disease is having hepatitis B or C, which are the more common ones we see here. Heavy drinking as well is an important one. Alcohol consumption, that's major. And then the other thing that we're seeing now is fatty liver disease. The technical name used to be non-alcoholic fatty liver disease. And so these are people that do not drink alcohol, but because of other factors like obesity, high blood pressure, diabetes, they've had fat begin to accumulate in their liver. And over time, that can cause liver damage and lead to cirrhosis as well. And so these are the big ones that we see and the factors that we should keep in mind. With hepatitis, we can talk more about that, but that is such a big one for this environment. Because what we see with hepatitis B, for example, is most people acquire it in vertical transmission. That means mother-to-child transmission. And so you get it from your mother, you're born, your mother has no idea she has it, the baby has no idea, the baby is healthy and it's fine, and you're living your good life with no issues. And it takes the virus about 20, 30 years to really cause serious damage. And so you have young people who are at the peak of their lives in their 30s and 40s, now coming down with liver cirrhosis, liver cancer, and it's really a common thing in Nigeria that we should all be aware of. Everyone, wherever you are, should for sure know your hepatitis B and C status, because you have no idea that it's there till boom, it causes something.
Okay. Yeah. So for hepatitis B, because I know that people vis-a-vis HIV, right? We talk more about HIV and less of hepatitis B. But we know that hepatitis B is more dangerous and it even kills faster too, right?
Well, it doesn't kill as fast as when you have AIDS, for example. And that's primarily because it takes the virus a long time. To, you go through a process from some inflammation in the liver to eventual scarring, and then the scarring gets worse to when the scarring is more advanced, where it's cirrhosis. And for some people, they could just go from the inflammation straight to cancer as well. But it usually takes about 20 to 30 years. But if you're born with it, that's enough lag time to have it be full-blown disease by the time you're in your 20s, 30s. And we see it in this environment quite a bit. People in their 20s, 30s, 40s with liver cancer, and it's almost always from getting the infection when they were born and having a long time for it to develop and manifest.
Okay, so because it's very common, right? I want us to just zero down on this hepatitis B.
Yes.
The risk factors. Okay, what are the presenting complaints, the symptoms? How do you, because you said you talk about mother-child transmission, right?
Yes.
The child is not even aware that he has hepatitis, and you begin to grow with it. So at what stage will the presentation come, and what are the things that will make it manifest?
Yes. Yes, so the unfortunate thing is that it's just, you will have no symptoms for the longest time because it's just there causing damage over time, right? And so if, for example, you didn't have, let's say someone goes to the hospital for malaria or something else, and then they check and find that your liver function test is deranged. And they might begin to probe and say, why is it high? Let's test for this and that. But if not, you have a normal, healthy childhood, no problems, go to university, do well, and then boom, it comes when it's already full-blown cirrhosis. And so except there's something else that helps you get diagnosed earlier, you'll have no idea, which is why just testing and screening is important. Given how significant it is here in the environment, it's one of those things where everyone should be getting screened for it, essentially, to know what their status is and know for sure. It's been done now where pregnant women are always tested for the virus. And so they're all tested, and if they are tested and they have it, there are things that can be done before childbirth and around childbirth to reduce the risk of the baby having it. And that's critical. That's, I feel like, one of the biggest gifts you can give the child, not to have like a disease, you know, when they are born and going on. And so testing is important. You know, the gynecologists are crucial in this as well, with testing their patients and making sure they help manage them to prevent the child from getting it. But coming to symptoms, so let's say someone has had it for 20, 30 years, they now have full-blown disease. The more common symptoms we see with liver disease include what we call jaundice. Jaundice means that the eyes begin to turn yellow, the urine turns a deep yellow as well, the stool might be pale, and that's usually the first sign that people have. They may begin to have lethargy, weakness, for some people low-grade fevers, and then subsequently, when it's just, you know, really bad, they can have what we call ascites, which means that fluid begins to build up in the belly, and they develop more complications as well. And these are all complications that have developed because the liver has now had a lot of scar tissue in it, what we call fibrosis or cirrhosis. And with that, it brings up a lot of complications from the pressure in the portal venous system being high. So there's a lot that can happen with it. There's something that we call varices, for example. Varices are big veins that can develop in the esophagus. And with that, you can have a lot of bleeding, vomiting of blood. You know, we have this common thing in Nigeria where they say, oh, someone went to the beer parlor and was drinking and started vomiting blood and it's poison. But in most cases, you know, someone may have, you know, advanced liver disease because you drink a lot and develop varices, and it's going to burst and cause you to vomit blood, and, you know, you can die from that. And some of these are just from the disease. And it's important that we are aware of these things. Yeah.
Do you want to take, when we talk about hepatitis, let's hear more about some other diseases that are associated with the liver. You mentioned fatty liver, that's also very common.
Yes, yes. So there are other things that can cause disease as well. Drinking alcohol heavily is a risk factor for liver disease. And it's something we see in the environment as well, commonly. You know, we tend to drink, you know, bring out the carton, or, you know, sit that we drink socially, and we do a lot socially, which is great to have social connections, but it's tied to drinking a lot. You know, we go to watch, you know, football, all of that, so about drinking. But really, the recommended consumption for men, it should be 2 drinks or less per day. 2 drinks or less, and, you know, with drinking, you know, they're classified differently from beer to wine to liquor. There's a recommended daily consumption for each one. And so for men, so beer, for example, it should be a 12-ounce can of beer that has 5% alcohol. But, the typical guy can have, 3 bottles at one sitting. That's, already past the daily dose that we should get. Women should be 1 drink or less in a day. Anything above that is significant and can contribute to liver disease. And so we see a lot of that as well. Drinking heavily, the liver gets cirrhosis and can lead to end-stage liver failure. So it's something that we should definitely keep in mind. Reduce alcohol consumption as much as we can. With drinking, I always say the less the better. The less the better. Leave that extra bottle, just 1 is fine, as little as you can. And drinking less helps not just for the liver, but for the heart. It's just healthy in general to drink as less as you can.
So I hear you when you talk about 5% alcohol. What kind of glass? I think it's good for us, because this is a family show.
Yes.
And there are people watching, and they're like,
Yes.
because your own glass will be different from somebody's own. Some people will use
Like
a
this
jug.
Yes.
Yeah, so
yes.
is it the regular
Yes.
drinking glass?
So there are precise definitions for the different categories. So for beer, for example, I don't have the full numbers, but for beer, it's a precise definition for how many ounces the bottle of beer should be and the percentage of alcohol. Wine is a little bit higher with the percentage, and it's very specific as well. I don't have I can give the numbers later for what it is.
That's for us.
It's very specific for wine, for liquor, for beer, and what is recommended daily.
We are not even here to promote it here. We are not even here to promote it.
Talking about this, because beer, the bottle.
There's a kind of beer, kind of a glass that's stored.
Is it compulsory that the person must finish that bottle?
No,
it's
so
not.
The
They
12
say
ounce is actually
better.
just the can. That small
That
can.
small
Why
can.
don't they
Yeah.
manufacture the smaller one? Then now I want to also say something. Okay, I want to say something that is a bit troubling. In the past, we used to ask, when you're asking the patient, we'll ask, are you a social drinker? You understand? Does that still hold? Because we know in our environment,
Culturally, so promoted.
we do a whole lot of socializing.
drinking,
Okay?
yes.
So if
For
you
weddings,
do that, yes,
for
weddings,
naming ceremony,
parties, a
for
whole lot of things
parties.
happen.
Yeah.
So
Yes.
does it still hold now?
So for us, we actually like to quantify how much people drink. So when we ask the questions, as specialists, we ask not just are you a social drinker, but do you drink alcohol? What do you drink? Ogogoro and beer are not the
They're
same,
not the
same
same.
level. Right? You want to ask to get a sense of how much, and then how much volume. Do you drink every day, 1 or 2 a day? Let's get a sense of volume. That matters a lot.
Yeah.
Knowing.
So in maintaining liver health, right? What is the role of lifestyle factors like diet and exercise?
Yes, that is critical actually. And the reason, so diet, the exercise you do, these are very important because they affect other things that are risk factors for liver disease. So I had mentioned earlier that there's something called non-alcoholic fatty liver disease. It has a new name now that's much longer, but most people know it as non-alcoholic fatty liver disease. These are people that do not drink but have liver damage as well because of fat deposition. And the risk factors for this include obesity, cholesterol problems, diabetes, and having blood pressure that's not well controlled. And these are all things that's always related to your exercise, how much you do your diet. So these things are very important. In the developed world now, the most common cause of liver cirrhosis now is actually fatty liver disease, right? Because in most developed countries like the US, you have 40-50% of the population having a BMI above 30, right? And so it's now taken over from hepatitis C, which used to be the more common one, to become the most common reason for people getting liver transplants.
Wow.
And in our environment, it's something that is not quite there yet, but it has that potential because our diet is becoming more westernized. As a culture, we typically celebrate a more fuller body, which is okay, but it's about balancing all of these things, right?
But don't go on the body image issue.
So it's very important.
Truly.
Exercise, lifestyle, just to reduce the risk of fatty liver disease, because that can also cause cirrhosis and cause all of that damage, even though they have not been drinking, but they have these other things that are contributing to.
Okay, so I'm sure our viewers actually saying you have talked too much about hepatitis, fatty liver disease, you mentioned cirrhosis. how is the diagnosis made?
Yes. So that's important.
And of
important
course, the
thing.
management.
Yes. So the goal really is to hopefully pick up on some of these things before you have symptoms, but most patients come in with symptoms. And so when they come in with the classic symptoms like jaundice, and then we do blood tests, first of all, we check to see your hepatitis B, C status and see what it shows. Hepatitis A is more acute infection, doesn't cause most of the things. And then we check for other things as well. Now, there are some other things that are more rare that can cause liver disease, right? There's autoimmune liver disease. There's things that can be genetic, they can get from your family. There's hemochromatosis. There are other things as well that we can test for just to see. But most people present with a clear history. Maybe they drink a lot and you have a full sense of what's causing their disease. After blood tests, we also will do a scan of the liver. The more common thing we do is the ultrasound scan. And that can look to see if you have fat deposits in your liver, if you have advanced to cirrhosis, if you have liver cancer, which can show a mass in your liver. The ultrasound can pick that up. For some patients, you may need a CAT scan or you may need the MRI done as well to get some better images. But that's the next thing to do. But putting together the clinical symptoms and their presentation with the blood test and with the scans that we do, we can get a true sense of what's going on and what stage they are in their process. For some patients, we may need to do what we call a fibroscan, which is a special kind of scan that can check the stiffness of the liver to see where you are in that progression.
And so, narrow it down to management.
Yes.
Both conventional, not conventional, and if there are some latest innovative approaches in management.
Yes, thank you for that. So management, it will all depend on what is the cause of your liver disease and what stage you are in the process. Are you just having an inflamed liver, or have you progressed to cirrhosis, or are you now at liver cancer, which is fully blown, and then the cause as well. So for hepatitis B and C, so with hepatitis B, it's not curable. However, there are medications that we can put you on to suppress the viral activity. And so people that are detected on time can be on medications, and that suppresses the effect of the virus and will not let you progress to advanced liver disease and cirrhosis. It keeps things at bay. Hepatitis C, however, is curable. We have the medications now over the last decade or so, and if you have it, you can be cured completely, and then you're fine. And then there's no risk of progression, which is great. If it's fatty liver disease, the recommendation is to try to modify your lifestyle, lose weight. If you can lose at least 10% of your body weight, that helps, and modify other factors as well. Diet, exercise, and do all of that. There's some medications that can help, but the main thing is lifestyle changes for that.
Thank you very much, Doctor. Before you give a final word to our audience, for the liver, we know that every medication that we take usually will go through the liver. You have to emphasize on that, because a lot of people abuse some medication, right? Usually with the analgesics. So
start with paracetamol. Paracetamol is highly abused.
Put emphasis on that. Every drug that we take goes through it, okay?
Yes.
So that said, I just want to say thank you for being part of our program. Before I let you go, maybe just a final word to our audience.
Thank you. A final word. The one thing you can do for yourself and your loved ones is know your hepatitis B and C status. It's critical. Know it. Up till the early 90s, we didn't have a program to vaccinate people in general for hepatitis B. We have it now, but know your status, and if you are negative, that is great. Make sure that you're vaccinated. Vaccines can help to prevent acquiring infection in the future. Know your status, vaccinate, very critical.
Thank you very much. Really appreciate your coming. And we look forward to having you again as our guest to talk more about other disease conditions, most likely with the liver. And to our viewers out there, I just want to say thank you for being part of today's program. You heard it all from Dr. Chudy on hepatitis, the risk factors. Now we have fat liver, hepatitis A, hepatitis C, the things that can make you have it. Genetics is also there. You probably will live without a symptom until you come down with the disease condition itself. So screening is very, very important. It's good to do that regularly. I just wonder about those women that give birth in places that are not standard. How are they able to screen this? But you also heard it from him that for pregnant women, they check If it's positive, there are medications and there are processes that what they will do to make sure that the child does not come down with hepatitis. So it's good, even if you are not attending the hospital for your antenatal, go and check the status of your hepatitis. If it's positive, seek medical help. And remember, analgesic, every medication that you take must go through the liver. So the liver has a very, very major role to play. Don't abuse the use of paracetamol because it's a major risk factor. On that note, I just want to say thank you. Until next time, my name is Dr. Martina Agbere. Stay blessed.
Thank you so much, Dr. Kenneth. That was such a brilliant discussion we had there. And to all our viewers, you can be rest assured this is the only program where you get the right information from the experts at any point in time. Please be kind to follow us on all our various social media platforms. And if you want to be part of this program, just go on our website, thephysiciansng.com, fill the form, and you are right here sharing from your wealth of knowledge. Until next time, my name is Dr. Memuna Yusuf Kadri. Remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.